All right, let's unpack this. Today, we're taking a deep dive into a really critical area of health. And honestly, it feels like it's been largely overlooked for way too long, especially when we talk about women's well being. We're focusing on the trigeminal nerve system, or TNS. You might also hear it called the chief sensory nerve of the brain, CSNB, from one of our sources, but we'll mostly stick with TNS today. And get this. Women statistically surpass men in, well, pretty much every major neurological and postural disorder. And not just by a little bit. We're talking 200 to 300%. Yeah, 2 to 3 times more likely to suffer from a whole host of chronic conditions. It's a huge disparity. Which leads to this powerful question right from our source material. Should persistent irritation to the brain's main sensory nerve, the TNS, be just like ignored in medical evaluations simply because the irritation starts in the mouth? So, our mission today is to explore why this link is so vital, what's being missed, and honestly, what it could mean for millions. And just to really paint the picture here, the list of conditions where women are so disproportionately affected, it's staggering. We're talking migraines, tension headaches, sinus headaches, fibromyalgia, chronic pain, insomnia, chronic fatigue, anxiety, panic attacks, also things like trigeminal neuralgia, IBS, eye pain, vision issues, Sjogren's, vertigo, lupus, MS, adult scoliosis, osteoarthritis, rheumatoid arthritis, depression, dementia, Alzheimer's. I mean, the list goes on.
It's extensive. And what's really key here is understanding the trigeminal nerve itself. It's the biggest of the 12 cranial nerves. Think of it like a massive information highway connecting straight to your brain. Its network is incredibly vast. It reaches your teeth, your jaws, the muscles you chew with, your eyes, ears, sinuses, even your neck muscles. So, okay, if the brain controls our physical and mental health, why isn't constant, lifelong irritation to this huge nerve system seen as clinically important? Especially when, it starts in the mouth, it seems hard to exclude it.
Exactly. And our source, Dr. Richard T. Seymour, he's been looking into this for like 40 years in his practice up in Milwaukee. He's got really compelling observations backed up by patient progress reports over decades. And he consistently finds that when you address these TNS issues, you can often eliminate or significantly reduce symptoms for at least 15 of those chronic disorders we listed. And importantly, without medications and their side effects. He even mentions patients he treated 30, maybe 40 years ago who are still seeing those benefits today. So how does this irritation actually happen, and why does it seem to fly under the radar so often in, standard medical checks? The article points at things like malocclusions, is basically when your bite is off, your teeth don't meet correctly, or things like missing teeth, crooked teeth, even dislocated TM joints, the jaw joints. These are all flags for skeletal misalignment in the skull.
Right. And from a purely mechanical view, it's physics, essentially. Poor bite alignment isn't somehow immune to Newtonian mechanics, right? So you get this mechanical friction between the TMJ, the jaw joint, and the auriculotemporal branch of the TNS. That's a major sensory nerve pathway right there. And that friction can trigger referred pain, sure, but also motor overstimulation. Basically, it keeps sending irritation signals. Over time, this isn't just a local jaw problem. It contributes to systemic issues. These forces can cause gum disease, tooth loss, chronic joint stress. And there are studies showing that if this misalignment starts early in life, it can overstimulate the TNS, leading to things like pain, fatigue, poor sleep, even from a young age. And here's a fascinating flip side. Later in life, people with dentures might actually get less neural stimulation through the TNS. And surprisingly, that reduction in stimulation might be linked to potentially faster cognitive decline and dementia. It's complex.
Wow. Okay, so given how much the TNS influences vision, hearing, sinuses, chewing, sleep, head posture, even blood flow in the brain, it really does sound like chronic irritation to the system has to be considered a major player in this epidemic of neurological and postural disorders in women. It feels like assessing the TNS should be part of every dental, medical, chiropractic, psychiatric, and neurological exam. It seems almost obvious when you lay it out like that.
You'd think so. But despite how critical it seems, research into TNS-related care is really underfunded. Especially, by pharmaceutical companies whose focus tends to be elsewhere, more on drug therapies. And adding to the frustration, insurance companies often exclude the key dental treatments needed for these conditions. So patients are kind of stuck.
And there's another layer to this challenge, right? Women who are already hit hardest by these disorders, they're also 4 times more likely to have dislocated TMJs, and just horribly 8.5 times more likely to suffer physical abuse, both situations that put immense stress directly on the TNS.
It's a confluence of factors. But here's where dentistry has a really unique position. Think about it. The teeth are the only part of our skeleton that's directly accessible from the outside. This gives dentists a unique way to support and stabilize the cranial structures. Our source talks about using advanced tools, like TechScan 3D bite force imaging, which basically maps out exactly how and where your teeth meet, showing the forces involved. And they use custom appliances, mandibular anterior repositioning appliances, to carefully restore alignment. We're talking precise alignment in all three dimensions: sagittal, frontal, horizontal, getting rid of deflections, preventing the jaw from closing too far.
And what's really smart, I think, is that they can use temporary orthotic appliances first. So before making any permanent changes like crowns or bridges, the patient can actually feel the difference. They can see if symptoms improve right away.
Exactly. It demonstrates the potential relief immediately.
Yeah.
Then, once they find that patient's ideal, stable jaw position, they can move to more permanent solutions. Things like crowns, bridges, implants, braces, overlay partials, whatever's needed to maintain that TNS comfort long-term and stop the chronic issues from coming back.
It makes intuitive sense, too. I mean, think about brain freeze, right? An icy drink hits the roof of your mouth, stimulates the maxillary branch of the TNS, and boom, forehead headache in seconds.
Right. A very direct connection.
So if that quick stimulus has such an immediate effect, why wouldn't decades of low-level, constant irritation from a bad bite lead to a lifelong cycle of pain and maybe even anxiety?
Which brings us to a really crucial point. Given everything we know, everything the evidence suggests, dismissing women's suffering, saying it's just psychosocial or hormonal or, all in her head, it's just not acceptable anymore. It's irresponsible, frankly.
So let's crystallize this. What does it mean for you listening and maybe for the future of healthcare? Our source really hammers home two urgent questions. First, why are these chronic attacks on the TNS, the brain's chief sensory nerve, just excluded from diagnostic protocols because they happen to start in the mouth? And second, why do major medical insurers consistently refuse to cover both the diagnosis and orthotic therapy stage phase 1 and the permanent treatment stage phase 2 for these TNS-related conditions, especially knowing they hit women so much harder?
Yeah, those are the core questions. And connecting it to the bigger picture, well, it seems absolutely vital that we inform women about these gaps in care, equip them, really, to start asking tough questions of their insurers, their lawmakers, their doctors and dentists. Because if you look at the full spectrum of TNS symptoms, not just, say, migraines in isolation, the number of women affected worldwide could easily be over 1 billion. It's massive. Organizations like the American Academy of Craniofacial Pain, the AACP, they're really well positioned to lead a change here by getting their members to reach out to influential women, advocacy groups, legislators, the media. We could build real momentum for drug-free preventive approaches. And let's face it, women are proactive about health, they are disproportionately affected here, and they make up over half the active voters. That's a powerful combination for driving change.
There's even a documentary, Stop the Headache, that shares stories of people whose lives were just completely turned around by this type of treatment. And here's something that really struck me. Dr. Seymour talks about women he treated over 30 years ago. These women are now in their 80s and 90s. They still come in for routine bite adjustments, bite balancing, and they're continuing to live independently, living vibrant lives. That's a powerful testament to the long-term impact.
It really is, and it highlights this deeper understanding that a balanced bite, balanced occlusion, isn't just about having straight teeth. It actually supports facial symmetry, yeah, maybe even beauty, but also mental clarity and overall systemic health throughout your entire life. And when the medical world continues to overlook the TNS, well, women often end up paying a huge price. We're talking endless rounds of medications, snowballing side effects, crushing medical debt, lost jobs, strained families, just immense needless suffering. As the source puts it so forcefully, and this is aimed at practitioners, we have no choice but to be experts of the trigeminal system. This statement is not a suggestion, it is a commandment. Pretty strong words.
Very strong. So we've taken a deep dive today into this profound and, often ignored link between how your face and jaw align, the trigeminal nerve, and this huge range of chronic disorders, especially in women. It's a powerful reminder of just how interconnected our bodies are and the urgent need for broader medical recognition and, frankly, for patient advocacy. So here's something for you to mull over as we wrap up. If a lifetime of what might seem like minor dental issues or jaw problems can contribute to such a massive cascade of systemic health problems, what other minor body parts or seemingly small localized irritations might hold the keys to other major health mysteries that we're currently overlooking?